Welcome back to my channel, guys. Today's topic is oncology. Starting with the introduction of oncology. Onco means mass, bulk or tumor. Logy means study. So basically it is the study of tumor, or we can say it as cancer. It deals with the prevention, diagnosis and treatment of cancer. One question that can be arised is, who is the father of oncology? So the father of oncology is B.J. Kennedy. Now, what is cancer? First of all, cancer is derived from a Greek word, crab. The crab can move in any direction. It can move in all directions, and so is cancer. It can also proliferate or metastasize or spread in any direction, anywhere in the body. Coming to the definition of cancer, it is an abnormal, excessive, uncontrolled or uncoordinated, purposeless proliferation of any cell. Basically, when a cell has lost control because of any environmental factor or exposure to carcinogens, or because of any gene mutation or failure of immune response, then the cell divides continuously, which is far away from normal, forming a mass or bulk, and this is known as cancer. It can be either benign or malignant. So the basic differences between benign and malignant is, the benign has slow growth. Okay, the tumor is slowly growing, whereas the malignant one is rapidly growing. It divides very fastly and it grows very rapidly. It's well differentiated, which means that we can identify the specialized structure and function of that cell. Okay, it mostly looks like a normal cell. And undifferentiated or poorly differentiated means we cannot identify the structure or function of the cell, and it looks far away from normal. Okay, it looks so abnormal. Capsulated means it is covered, it has a covering, it is confined to one area. Non-capsulated means it is not covered, means it can spread anywhere. Okay, having localized effect means only the area where the growth is happening, that place is affected, and it is not it is not affecting other places. Having generalized effect, the malignant is having generalized effect, means it can move, spread, so the effect can be generalized. Okay, it can be seen in the whole body. Benign, it has the inability to cause tissue destruction or death, and malignant, ability to cause destruction and death of the tissues. The most important thing we have to know about benign and malignant tumor is that the benign does not metastasize. Okay, metastasis means that the cancer can spread from one part of the organ, one part of the body to another part of the body to another organ, and malignant can metastasize. So this is the most important difference in benign and malignant tumor, that it can metastasize. The malignant one can be metastasized. One question in ESIC 2019 appeared that which of the following is not a typical difference factor between benign and malignant tumor? The options were growth rate, encapsulation, cell differentiation, and size of the tumor. As we can see that growth is one of the factor, differentiation is one of the factor, capsulation is one of the factor. Is there any factor related to size? No. So the answer was size of the tumor. It is not a typical difference factor between benign and malignant tumor. I hope it is clear to you. First is neoplasia. Neo means new, plasia means growth. So it is basically the new growth. For example, fibroadenoma of the breast. Fibroadenoma is a benign neoplasm of the breast. Next is hypertrophy. Hypertrophy means increase in the size of the organ because of increase in the size of the cell. For example, cardiac hypertrophy, in which the size of the heart is increasing because of overexertion of the cardiac muscle. The cardiac muscles tends to increase in the size, which ultimately lead to increase in the size of the heart. I think it is clear. Next is hyperplasia. Hyperplasia is increase in the size of the organ because of increase in the number of cells. The cell is continuously proliferating. For example, the endometrial hyperplasia, in which the endometrium is continuously proliferating and the number of cells is increased, and because of that the uterus size is increased. Okay, this is hyperplasia. I think it is clear to you. This both hypertrophy and hyperplasia. You must keep in mind, hypertrophy is because of increase in the size of the cell, and plasia is because of increase in the number of cell. The question can be asked from hypertrophy and hyperplasia. Please keep in mind. Next is anaplasia. Anaplasia is poor cell differentiation. I told you at first that cell differentiation means that we can identify that the cell, what the cell is, what is its function, what is its structure, we can identify. But in poor cell differentiation, we cannot identify what kind of cell it is or what is its function. So this is anaplasia, when the cell is poorly differentiated. This can also be asked. Okay, and this is the hallmark for cancer. Next is aplasia. Aplasia means failure of organ to develop or function normally. Okay, when the organ is not developed or is not functioning properly, normally, then it is aplasia. Dysplasia means abnormal development of cells within the tissues. Okay, what does dysplasia mean? It is a abnormal development of cells within the tissue. It is a type of atypical hyperplasia. Okay, atypical hyperplasia means number of cells is increasing within the tissue, because of which abnormal development of cell takes place. Next is carcinoma in situ, which is abnormal cells found only in the place where it is first formed, means the place of origin. The cancer confined to the place of origin. Next is invasive carcinoma, means the cancer is spreading. When the cancer cell have broken out of the lobule where they began and have the potential to spread to the lymph nodes and other area of the body, then it is known as invasive carcinoma. For example, invasive ductal carcinoma, in which initially the carcinoma is within the milk duct of the breast, and later on it invades to or spread to the fibrous fatty tissue of the breast, which is outside the duct. So this is invasive carcinoma. Next is metaplasia, replacement of one type of cell with other type of cell. Okay, metaplasia means replacement. Metastasis means spread of that carcinoma to other part of the body. Like if the cancer is in the breast, then it can spread or metastasize through the blood or lymphatic system to other body parts, like the liver or bone or kidney, anyway. Okay, or the lungs. I think it is clear. This is the most important slide of the oncology, so please learn this all. Okay, this can be asked. So many questions can be asked from here. Most important is the hypertrophy, hyperplasia, anaplasia. Okay, coming to type of cancer, first is carcinoma, which means cancer of epithelial cells, the tissues that lines the inner and the outer cells of the body is the epithelial cells. Example is basal cell carcinoma, adenocarcinoma. Adenocarcinoma is the cancer of glandular epithelium. It can be squamous cell carcinoma, which means the cancer of squamous cell. Next is sarcoma, cancer that arises from the transformed cells of the mesenchymal origin. Connective tissues like the bone. If the bone is affected, then it is known as osteosarcoma. If the cartilage is affected, it is known as chondrosarcoma. If the fat or the adipose tissue is affected, then it is known as lipomyosarcoma. If the muscle, like the skeleton muscle, is affected, then it is known as rhabdomyosarcoma. If the smooth muscle is affected, then it is known as leiomyosarcoma. If the vascular is affected, the vessels are affected, it is known as hemangiosarcoma. Ewing sarcoma is the sarcoma of the hip. Next is lymphoma, cancer arising from the lymphocytes, as the name suggests, lymphoma. Okay, that is the white blood cells. It can be Hodgkin's lymphoma and non-Hodgkin's lymphoma. Melanoma is the cancer of pigment containing cells, the melanocytes, that gives the body color. Okay, then it can cause skin cancer, as it is present in the skin. Next is leukemia. Leukemia means cancer arising from the bone marrow and result in high number of abnormal blood cells. Okay, the cancer of the blood is known as leukemia. Okay, now next is the place of origin of the tumor and what it is called when it is benign and what it is called when it is malignant. I have almost covered the malignant tumor part. We can just see the benign tumors, okay? First is glandular epithelium. Benign is known as adenoma. Surface of squamous epithelium is known as papilloma. Fibroblast is known as fibroma. Cartilage is known as chondroma. Striated muscles or the skeletal muscles are known as rhabdomyoma. Smooth muscle, leiomyoma. Blood vessels, hemangioma. Endothelium, malignant is known as angiosarcoma. Okay. Then fat is known as lipoma. Then bone is known as osteoma and liver is known as hepatoma. And the malignant is known as hepatocellular carcinoma. I think it is clear to you. Please learn these terms, okay? I think it can be also asked in the MCQ sections. So please go through it. Next is etiology, means the causative factors. Why the tumor or the cancer is caused. First is the endogenous and second is exogenous. Endogenous, first is age. When the person gets older, they are more prone to get cancer. Okay. Example, like if a male who is more than 50 years of age, he has chances of getting prostate cancer. Okay. And hereditary means it can be inherited from the ancestors. Means it can run in the family, like the breast cancer, most commonly. Okay. Next is gender. Male are more prone to prostate cancer or testicular cancer, and females are prone to ovarian and breast cancer. Race means some cancers are most specifically found in some races, like the male South African are more prone to liver cancer and the female American is more prone to breast cancer. Next is exogenous. Exogenous means from the external factors. Okay, the first is radiation, like the UV rays from the sun. It can cause skin cancer, okay? Then heat. Heat can also cause cancer, means prolonged exposure to heat. One is Kangri. Kangri cancer is a type of skin cancer, mostly found in Kashmiri people because of extremely cold environment. They use Kangri, a type of heating object, and because of prolonged exposure to heat, it can cause skin cancer. And what is Chota cancer? It is a type of oral cancer. The South Indian people are using cigar, okay, because of prolonged exposure to that carcinogenic substance, the person is prone to get oral cancer. Then irritation because of skin irritation, sometimes that some substances that can cause irritation to the skin, then that it can also cause skin cancer. Next is bacteria, like in gastric cancer, that H. pylori, Helicobacter pylori, is responsible for causing gastric cancer. Then high salt diet can also cause gastric cancer. Then viruses like Epstein-Barr virus, which can cause lymphomas, Hodgkin lymphoma. Then hepatitis B and C viruses, then that can cause liver cancer. Then cytomegaloviruses, that it can cause Kaposi's sarcoma and ultimately AIDS. Then human papilloma virus, it can cause cervical cancer. Right, and some fungi like the Aspergillus flavus, it can cause bladder and liver cancer. So these are the factors which are responsible for cancer. Okay. Next is warning signs of cancer. We can memorize it by a mnemonic called caution. Okay. C for change in the bladder or bowel habit. If the person is continuously having problems with the bowel and bladder functioning, like if the frequency is increased, decreased, or the urgency is increased or decreased, it can be a sign of cancer. Second is a sore that doesn't heal. Okay, a continuous sore in a body which is not healing. Okay. And third is unusual bleeding and discharge. Like in cervical cancer, if there is unusual bleeding, continuous bleeding from the cervix, then it can indicate cancer of the cervix. Then thickening of or lump in breast or elsewhere. Mostly the lump in breast are benign, but if there is a lump in the breast, then it can be, susceptible. The person is more susceptible to get cancer. Then indigestion or this difficulty or in swallowing, it can indicate that the person is having oral cancer or esophageal cancer, something like that, or throat cancer, anything. Then obvious change in water mole, when there is changes in the mole or wart. Either it can be excessive proliferation, or it can be some signs or symptoms like bleeding or itching or something. Next is nagging cough or hoarseness. Okay, continuous cough and hoarseness can also be a sign of cancer, laryngeal cancer. This is nagging. Now coming to TNM classification. TNM classification means T for extent of primary tumor, N for regional lymph node involvement, and M for distant metastasis. TX stand for primary tumor cannot be assessed. X is the term used for cannot be assessed. Okay, primary tumor cannot be assessed. NX means regional lymph node cannot be assessed, and MX means distant metastasis cannot be assessed. T naught is there is no evidence of primary tumor. N naught means no regional lymph node involvement. M naught means no distant metastasis. TIS means carcinoma in situ. Okay, where it was first originated. The cancer is confined to that place. Then T1, T2, T3, T4. It is arranged in terms of increasing size and local extent of primary tumor. Okay. Based on this, it is grouped. Then N1, N2, N3. Based upon the extent of regional lymph node involvement, this N1, N2, N3 is classified. Then M1 means distant metastasis is present. Next is grading. GX means grade cannot be assessed. Okay, undetermined grade. G1 means well differentiated, low grade. Mild dysplasia means like there is growth in the cell. Mild dysplasia. Dysplasia means what? Abnormal development of cell within the tissue or organ. So there is some growth within the organ or tissue, abnormal growth, but it is well differentiated. Means we can identify its structure and function. Then moderately differentiated is G2. Okay, this is the intermediate grade. There is moderate dysplasia present. Then G3. G3 is poorly differentiated. Okay, means we cannot differentiate the type of cell and what is its function. It is high grade and it is showing severe dysplasia. The cell is showing severe dysplasia. G4 is undifferentiated. Okay, that means the cancer is in its worst stage. And anaplasia is present. It is a hallmark for cancer, right? That's it for today, guys. I hope you liked my video. Please do like and subscribe my channel for more updates related to oncology right now.